Welcome to my channel Medna Champs by Paru. Let us discuss few multiple choice questions from obstetrics. Question number 1. What is the color of amniotic fluid when the bag of waters rupture? Option A clear, option B green, option C brownish and option D is golden. So what is the normal color of amniotic fluid? It is clear in color. Option A is the right option. While it looks green when it is meconium stained, it looks golden when post-maturity is diagnosed. In case of intrauterine death, it changes into reddish brown in color. Question number 2. What is the normal position of uterus? Option A, anteversion and anteflexion. Option B, dorsivert and dorsiflexion. Option C, anteversion and dorsiflexion. And option D, dorsiflexion and anteflexion. So what is the normal position of uterus? It is option A, anteversion and anteflexion. Here you can see the normal position, anteversion, anteflexion, as well as abnormal positions, retroversion and retroflexion. Question number 3. Which of the following injections is given to improve uterine contractions in second stage of labor? So to stimulate uterine contraction, which injection is administered? Option A, prostaglandin. Option B, oxytocin. Option C, Finargan. And option D is diazepam. So obviously, oxytocin. Option B is the right answer because it is uterine stimulant. Normally, oxytocin is secreted from posterior lobe of pituitary gland, which will stimulate the uterine contractions. So this oxytocin reflex is also helpful in milk ejection. That is why it is also called as milk ejection reflex. Question number 4. Purple blue tinge of cervix is known as what during pregnancy? So during pregnancy, there are many physiological changes happening in a woman. So in that, one such change is bluish discoloration. Option A, Hagar sign. Option B, Gödel sign. Option C, Chadwick sign. And option D, McDonald sign. So the right option is Chadwick sign. So there will be purple bluish discoloration of vagina as well as cervical mucosa. This is because of increased blood supply to that area, or vascularity in other words. Question number 5. Premature separation of a normally situated placenta during second half of pregnancy with severe hemorrhage is known as what? Option A, abruptio placenta. Option B, ectopic pregnancy. Option C, placenta previa. And option D is cervical incompetence. So here the question is premature separation of normally situated placenta. That term you have to remember, normally situated placenta. So here it is premature separation. Option A is the right answer, abruptio placenta. So this is a form of antepartum hemorrhage again, where you can see premature separation of placenta with bleeding as well as uterine contractions, and in case fetal distress also may be possible. Question number 6. Postpartum hemorrhage is loss of blood more than option A 800 ml, B 100 ml, C 500 ml and D 900 ml. So according to World Health Organization, blood loss of more than 500 ml is termed as PPH, postpartum hemorrhage. Question number 7. What is the fertilization lifespan of oocyte? Lifespan of oocyte. Option A is less than 12 hours, B 12 to 24 hours, C 24 to 48 hours and option D is 48 to 72 hours. So what is the lifespan? It is 1 day, 12 to 24 hours. Option B. While the lifespan of spermatozoa is 48 to 72 hours. Question number 8. What is the suture that lies between two parietal bones known as? So sutures are like joints in adults. In fetal skull, there will be a suture lying between two bones. Option A, sagittal suture, B, frontal suture, C, coronal suture and option D is lambdoidal suture. So the right option is sagittal suture, that will separate the two parietal bones. Frontal suture separates the frontal bone Coronal suture separates the frontal and parietal bone. Lambdoidal suture separates between the parietal and occipital bone. So sagittal suture is that which lies between the two parietal bones. Question number 9. What is the normal duration of puparium? Option A 3 weeks, B 4 weeks, C 5 weeks and D 6 weeks. What is the normal duration of puparium? Option D 6 weeks. Question number 10. What is a major galactokinetic hormone? Galactokinetic for lactation. Option A oxytocin, B prolactin, C estrogen and D progesterone. Which hormone is termed as galactokinetic hormone? Option A oxytocin is the hormone which is termed as galactokinetic hormone. Question number 11. Circlage operation is the surgical management of choice for. So this is a surgical management for which condition? Cancer cervix, cervical incompetence, fibroid uterus and hydatiform mole. So which is the condition where they will be using this circlage operation? So the option B is the right option, cervical incompetence, which is again a major reason for abortions to happen. Snowstorm pattern on ultrasound with no fetus or gestational sac is the characteristic feature of which condition? Snowstorm. When an ultrasonography is taken, there won't be any gestational sac, but instead they can see snowstorm appearance. Option A eclampsia, B placenta previa, C abruptio placenta and D is hydatiform mole. So the right option is option D hydatiform mole, where vesicles, grape-like vesicles will be formed which will be seen as snowstorm in ultrasonography. Question number 13. What is the antidote given for magnesium sulfate? Option A calcium gluconate, B potassium chloride, C sodium nitroprusside and D verapamil. So magnesium sulfate is a drug of choice used for preeclampsia condition. In that case, if magnesium dosage is too much, magnesium toxicity will be resulting. As an antidote, we will be administering calcium gluconate. That is the right option. Question number 14. Which is the immunoglobulin that is present in breast milk? IgA, IgD, IgG and IgM. So via breast milk, which is transferred? IgA. IgA is the immunoglobulin present as antibody and it will be passed via breast milk to the neonate. Question number 15. Which is the instrument used for collecting pap smear? Air spatula, Piper forceps, Neville-Barnes forceps and Simpson's forceps. Which is that? So from that name you should be able to understand spatula. Air spatula is the one which is used for collecting pap smear sample. So usually you can use a brush and a spatula. Here in this image you can see a wooden type of air spatula. This is Piper's forceps, obstetrical forceps. The remaining three are obstetrical forceps. Piper's forceps, Neville-Barnes forceps. This one is Neville-Barnes forceps. And the last one, Simpson's forceps. All the three are obstetrical forceps for malpresentations. That's it. Thank you. Hope you liked my video. Please like and subscribe. Thank you.